Yeah, Dr. Jitesh, please continue because now we are on the YouTube also.
Okay, sir. So, so let us start with a very short case. First, it's a case of Bell's palsy. 12-year-old female suffering from facial paralysis, left-sided since birth.
We are on the YouTube also.
Mouth distorted, left-sided. Mother history during pregnancy. Doctor suggested for vacuum delivery since the delivery she is suffering from facial paralysis. Date of visit 23rd April. Is the video visible to everyone?
Yes.
Okay.
जीप से हाँ लेफ्ट राइट करो टंग बाहर करो उसको लेफ्ट राइट करो वो पूरा होता है ना क्लिप बंद करो क्या नाम है वंशिका शर्मा
So this is the date of visit. First visit 23rd April. This is after medicine. After 1 month.
ऐसे ऐसे करो
You can see the change. This is on 23rd May.
मुंह खोल के अभी करो अच्छे से पूरा मुंडी थोड़ा सीधा करो अभी करो अच्छा ठीक है
This is after 2 months, like 11 June. So everyone can see the change now. So this is a very short case, and I would really require everybody inputs here. That what was the remedy given here? That is the case here. Nothing else. And since delivery, child is facing this facial paralysis. So can I see the inputs here in the chats? Okay. So everyone please tell me the medicine. Let me go back. Cadmium. Very good. This is the case. 12-year-old girl. Causticum. Very nice. This is a mother history. More Miserium. Okay. Sina Alif Belladonna. Okay. Dr. Dalcamara. Phosphorus. Sina Alif Arnica. Okay. Very nice. Veer Dalcamara. Dr. R. Tejasvi. Phosphorus. Dr. Muhammad Chia. I think China. Okay. Any more inputs? Staph, Miserium, cadmium salt. Okay. Nux vomica, Gelsemium. Dr. Nikita, Nux vomica, Dr. Surbin, atom sulfaceous. Okay. Anyone else? Dr. Pramod Lanke, belly spur. Okay. Naxwamika, Dr. Vikas Belladonna. Okay. Hypericum, Dr. Jay Shukla Arnika. Okay. So, can anyone tell me what was the exciting cause here? Arnica hypericum. Why people can't be specific with one remedy? Is it necessary to mention two remedies at once? Or you are giving me a choice to either one of the remedies correct? Okay, Dr. Divya, you are absolutely right. That is a birth injury, vacuum delivery. So everybody is coming up with a remedy now. Dr. Poonam, Arnika, Preeti. Yes, that was the point there. Once we focused, as it was a vacuum delivery, it's done. I gave Arnika only. And if you read Allen's keynote, there is clearly written in the nervous system chapter mechanical injuries. One word. It's done. She's still on Arnika only. And she's improving. So this prescription, the motto was showing this case that you can also do this, what I am doing. All you need to focus, what was the cause, how did it happen. Don't be too precise that okay, it's a left-sided, so we'll think of cadmium sulfate. But not all cases is this. That's a repetition on TDS. She's still taking it. She's on 0 by 3 now. She's better. You saw the last video on 11 June. So now my question is whether you will be like once you know the picture that what has to be treated, you will be actually knowing that the prescription is very easy. But unless you don't know what has to be treated, the prescription is going to be very difficult. Am I clear? Say yes in the box if it okay. Okay. So I think it was a very easy case. Once I made you guys to think only on the cause, everyone was ready. Like everyone was ready with their remedies. Arnika. So why not everyone focus rather on the case here? That what I wrote in the case, I clearly mentioned that what had happened. So your entire focus should have been on that history that this was done and since birth. So since birth there is an injury due to vacuum delivery, finish. That's Arnika because it was a mechanical injury. So you have to understand your prescription should be on only on the cause. What is the cause here? And for that you need to read the case in and out. If you don't even understand, just read it twice, thrice, so that you can work on it. That where you should focus more. So coming up next, case of gallbladder cancer, GB carcinoma. Everyone watch the case and write down the notes so that you can work on it together and you can tell me the remedy which you think it should be. So 77 years female, case of CAGB. Investigation clearly showed that there is a mass setting of chronic calculus cholecystitis. MRI was clearly suggestive for possible GB carcinoma with liver infiltration, periportal and peripancreatic adenopathy as described. This is the investigation part. So what is the chief complaint? It's a journey of disease. We generally ask a journey of disease, how it started. She had a uterine prolapse since 30 years, but she operated in 2018. Then she suffered from jaundice 1 month. Then in February, she had a stomach ache. Then she did the test and they diagnosed as jaundice and stone in gallbladder. Then after that, they was obviously referred with the cancer ward. and they said that they cannot, nothing can be done, and she was taking on painkiller which is not at all acting on her stomach pain. So complaints of jaundice, yellow skin, whole abdomen pain, eating aggravation, drinking ml, is dull, cannot talk, cannot walk without support, cannot sit, lying on left side, aggravation, lying on back side and right side, ml, nausea during brushing, application of water, ml, and bathing also, ml, knee chest position pain, ameliorates sometimes, and cannot tolerate cooler and fan, head hot, soul cold, and she also needs 30 minutes of bathing now. Okay, this was the chief complaint. So this is the case taking video which I'm showing. This is an might be there is a language issue, but I'll help to translate what exactly is asking. So my assistant doctor is asking what is the problem. He's telling that he got checkup and he got diagnosed jaundice. She was diagnosed as jaundice. You just keep on observing the patient, everyone.
ब्लड टेस्ट करली अल्ट्रासाउंड करली ब्लड टेस्ट एटा जॉन्डिस अछि कहले आ अल्ट्रासाउंड रे स्टोन अछि कहले.
So in ultrasound they found out that it is a stone.
आजे के ऑपरेशन रे कर देबो जॉन्डिस गला परे के स्टोन ऑपरेशन हवा करे एटा ठीक अछि भाई. तापर जॉन्डिस के छनाला करके मते 28 तारीख के बुला नहीं 24 दिन परे.
He took her to the Burla Medical College nearby.
स्टोन दिल्ली गला ना कहले एमआरआई टेस्ट करले बोलला समाधान एमआरआई टेस्ट करले 28 तारीख तापर बुधवार दिन.
See, the patient pain has started.
कर मिलला रिपोर्ट देखले डॉक्टर का कहले ना दिल्ली गला कैंसर वाला टिके देखले देखे रे हो.
So he got referred to the cancer ward after showing all the reports.
बुधवार दिन सकाळ कैंसर वाला निकले कैंसर वाला ने देखाली जेते बेले मरले जना.
She's getting restless now due to pain. She said that I am getting lot of stomach pain. She asked what is happening. My assistant is asking where is the location of the pain. She is showing everybody see the area which she is indicating it. She asked as the whole complete your abdomen is paining. She said all the time it's paining. And when if she, my assistant doctor is asking if I press, if the pain gets more or less. Her son is saying that sometimes the pain gets decreased, then it flares up. Again, she's asking if I'm pressing, you're getting pain or not. She said yes. That's what the son is telling, that after seeing in the onco department, the doctor said that nothing can be done. Please take her home.
ठीक अछि बोली आने मेडिसिन के लेखाई देली दर्द कमर मेडिसिन देली पेन किलर लिखि देली लागु छै तारपरे घर के आने पर मेडिसिन के दे देले दर्द कमी जाउते.
He brought her home, then after taking the medicine, the pain gets reduced, then again starts.
तारपरे फिर मजे दर्द बढ़े तारपरे खाना करले टेंशन के नबाली पड़वा डॉक्टर नहीं कहले भी घरे रखी ना घर.
He's telling somewhere I have to show my mother, because if doctor is even just saying to stay, put her at home, I cannot see in her pain, of course. So he has to go to the doctor so that he can help her mother.
देखी ना तो डॉक्टर ने नेली समय कहले कटक नावाली पड़वा कटक नवाली पड़वा विकास कटक नवाली पड़वा कटक नेले सिनो तुमको केमो देबे दे बोले केमो देले तार शक्ति ना यार केमो नहीं पारे
They recommended her chemo, but she cannot tolerate it, so they didn't give her chemo.
तारपरे हमको जी आनी छन हमको जी आनी छन ताको आमे कहनु बोले सिमाना कहले आमे चलो गुडे हॉस्पिटल.
So everyone can see what position she is lying on. Bend knee chest. Okay, very good. Next video. So she's in big pain. You can see bending double. Okay, very nice. She has already been given the medicine, and my team is asking to repeat the medicine. So this was the case. Past history: second degree uterine prolapse, operated. Family history: late uncle son's father paralysis, hypertension, uncle son's mother brain tumor, operated. Physical generals habit: she takes tea 3 to 4 times a day. Desire sabudana, sour. She had a sour desire before. Now she doesn't eat. Headache, teeth caries, operated. Urine hematuria 5 to 6 times. Stool small ball types in last 4 days. Perspiration less. Dreams always of dead bodies. Mild childhood, joint family. टेंशन में क्यों टेंशन लूं, सब अच्छे हैं. Anger, shout if anger if someone doesn't listen to her. She said, give me medicine and cure me. How does she react to lies? And she said, कौन क्यों झूठ बोलेगा? She feels bad if somebody said lies. So anxiety about health, मेरा पेट दर्द कम हो जाए बस. Fear, insult, feels bad. So she is telling that मेरा पेट दर्द कम हो जाए बस. Nothing else she wants. Thermal towards hot. So after medicine, 4 doses. She's complaining of leg pain more. After more 4 doses.
वैसे उनका नाम क्या है?
उदिसा हो.
इनको क्या हो रहा था?
उसका पेट दर्द हो रहा था.
कब से हो रहा था?
दर्द तो हो रहा था 1 महीना हो गया.
अच्छा, डॉक्टर को दिखाए थे?
दिखाया था.
तो डॉक्टर.
This is the feedback video which I'm taking after I think almost it's written 4 doses, but it's 8 doses almost.
क्या बोले?
उसका स्टोन है और उसके बाद डंडिस है. डंडिस जाने के बाद स्टोन ऑपरेशन होगा कर रहे थे. डंडिस खत्म नहीं हुआ फिर भी और स्टोन हिल गया. तो डॉक्टर बोले कैंसर वार्ड पे जाओ, वहाँ से दिखाओ. उसके बाद क्या करना है बताइएगा.
ठीक है. अब आप इनको जब लेके आए यहाँ पे तो उनको क्या हो रहा था?
पेट का दर्द हो रहा था.
अभी मेडिसिन लेने के बाद कैसे है? अच्छा, आपको लग रहा है थोड़ा कम हुआ है? कितना %? 10 में से कितना ठीक लग रहा है आपको?
1-2% कम 8%
कम होगा, ठीक है।
Almost 80%. She is
मौसी
better.
मौसी ये उठिए बसो तो टिके।
She asked her to sit on the couch.
ऐसे उनका ना
So after 8 doses, this is the same. She's asking that in home whether she was able to walk without support. So her attendant replies no. She used to walk with a stick in her hand, now without any support. So now coming to the medicine part. I'm not here like to show the remedy more. I'm more here to make you people learn how to reach to the simillimum. So this was the case. Now everybody share their inputs that what they have learned and why. Medorino. Okay, very nice. Magfos. Colosine. Okay. Any more inputs? Colosine, Monica, Violini, Colosine, Colosine. Chelidonium, Agenicum colocin, Chelidonium. Okay, Chelidonium. Colocin. Colocin intercurrent with carcinosin. Okay. Colchicum. Okay. Arsenic album. Okay. Revista colocin and calculated. Okay. Why not one? Only one. Why everybody has such a doubt on the prescriptions? Even if it's wrong, at least try to be perfect with at least one remedy, whatever you say. Don't give options like either colocin or calculated. If it's okay, like even if you're wrong, it's okay. You should learn actually what is the difference between those. So more suggestions, please. Colocin, chelidonium. So tell me what was the key point in prescription here? We should see the pathology or we should see the symptoms of the patient here. Tell me. Lata, Dr. Lata, symptoms, bending double, Podu. Okay. Econite. Symptoms. Dr. Janikam pathology, bending on knee. Okay, Restox. Strong pain modalities, Dr. Ankit. Dr. Monica symptoms. Chelidonium. Okay. So, okay, for remedy selection, we need to consider both. Okay. So why we are so focused with the pathology here? Why? So we are dealing with a case here of a carcinoma, and we all know that it is just a palliative. It's just a palliative treatment. It's very difficult that this case is going to be cured. It's very difficult. But now your prescription should match the symptoms which the patient is suffering. So majority of the prescription came to colocin. So congratulations, the remedy was colocin. Now the patient is still on colocin 0/4, and she's still better. Still, we don't know how far this case is going to be better, but she's still stable in colocin 0/4. As per the last update we got. So I'm here to show why you are not taking mental symptoms, because she was not ready to give anything. She just wanted to get rid of her pain. And what you have to do as a doctor to treat the patient. And this case was clearly, clearly you can see the fantastic expression of colocin in the case. And we prescribed on what we saw. There were no theories or nothing. Definitely, we should consider restless, but the anxiety, if the patient is suffering from such a long period, do you still consider restless and anxiety about her health? That's quite common, right? When the patient is suffering from since long about the pain, and even after taking painkillers, she's not getting relief. And one important point I remember, I just yeah, she was not able to sleep due to pain, and after colocin, she started sleeping. That's the update we got on the very after 2 days itself. That till that deep action colocin worked, and that was amazing to know. So that made my confidence, my team confidence, that yes, colocin can work at such deep level of cases. It's not about, this is chronic remedy, this is acute remedy. It's a bakwas. Whatever you see, you take, you prescribe. Don't be prejudiced that this this medicine works only in that condition. Like everybody came to the pathological system chelidonium. Why everybody is considered only chelidonium? Why? Just because there's a pathology in gallbladder and liver, we have considered chelidonium. But if to answer rest of the questions, colocin does has the action of liver. If I want you to see on the other side of the colocin, it does have an action on liver. But that is not the point. We are not here to discuss what the remedy sphere of action here is. How do you select the prescription? That is the main point. How do you exactly reach that what is to be given? That was considered here. And yes, this prescription is based on only on pain modalities. It was only colocin. You can repeat LM in every 5 minutes. And suppose the patient's pain is getting better, you can increase the duration of the repetition. She's still on TDS on colocin 0/4. On deep chronic cases, I prefer to give LM. That is the potency which is more preferable to use. That is the potency choice. Whose vitality is very low, you should choose LM always. So this is how homeopathy is. Simple. We are not gods that we can treat everyone. But how do you manage your case? If suppose a patient is coming with a high hope at your desk, at your door, that sir, please help me. And if you're not able to do that, it's gonna be quite difficult in future. So we have to all learn that how do you manage these kind of cases? How? LM-potency aggravates doesn't. Unless the patient is idiosyncratic, you won't find any aggravation of LM. So this all 50 millisiemel scale, as far as my experience, I never found it aggravation in cases. Either it worked or either it didn't work. So that's my prescription, because I have been doing LM since recently 3 to 4 years. So that's my experience. I never found aggravation through LM. Rather, I found it in CM. So all we have to learn here, the prescription strategy, or you can say the prescription selection basis on what you see. You cannot dig up the case more further because the patient is in excruciating pain. And why will the patient will describe what is happening? You cannot investigate further. And when you hit the arrow, because like in the last session we discussed the same thing, when the patient comes in acute case at your clinic, you can get the real picture of the case. This is what happened here itself. When I got the complete picture in front of my eye, I said this is the medicine on based on the symptoms, and it worked. So it is very simple to treat on what you see and what you observe. So whole prescription was on observation. That is the whole motto here. How your observation only can lead to your like remedy selection will be easier only on observation of what you are seeing on the patient, how the patient is behaving. Yes, definitely we should focus on observation and modalities in pain, acute pain, definitely. And to conclude, you should be free from prejudice. Why can't we cure this gallbladder by this medicine? I don't know whether this case will be cured or not, because the patient is still under treatment. She's still better, but I don't know till what extent, because the pain, the remedy is helping her. She's better, she's eating properly, sleeping properly. Her routine has been improved after our medicine, and the family is also happy. So we don't know till how long we'll be able to manage this case, but she's better. So let us see. Now the question is how we can do this. Yes, definitely, Dr. Ajay, it's a palliative treatment. Not all cancers are curable, is it? Please show the slides again. Okay. This is the case history. This is chief complaint. Dr. Sunita, they haven't checked yet, but she is better, and her yellowness also is less. So they haven't checked yet. We'll have a review soon, and I'll update it. But the patient is better.
Yeah.
And they live on a very rural area. Can we prescribe 30C if LM potassium? Definitely, you can prescribe 30C if LM is not available. So, sir, why we take whole history in this case and prescribe observational modality? Because we should know in and out of the case. And your prescription, it should only on the what is in front of you. Might be in future, if any new symptoms appear or any different thing, I may change my prescription. But this was the case, and this is the symptoms, and I prescribe on what I saw. So I'll be very transparent. What I saw, I prescribe. Now, if the patient is better, I don't want to uh, like interfere or put a hindrance in the case. So unless she complains any new symptoms or anything come, I don't want to change prescription, and we should not do it. Dr. Daksh, as the Dr. Hughes says that since the homeopathic drugs in their proving were never taken till the stage where the pathology is changed, so it would be difficult to say if the carcinoma it should be treated or not. See, it's not like this, but we have to see here that whether what we are able to do, either we are providing a palliative treatment in the carcinoma cases, or we need to just manage the case, or very like in the early cases might be possible that cases get cured, might be, but there are exceptions always. So Dr. Pramod, that means to cure the deep pathology we need series of correct remedy. Yes, like definitely it depends upon the patient's state. If the patient is better on this particular remedy, then why to interfere? If any new picture comes up, then definitely we can prescribe. What's wrong in it? Dr. Monica, why sir we shouldn't change the prescription? No, we should change the prescription if the new symptoms appear. We have to see till what level it is. Dr. R.K. Sawant, how to choose potency? It's a long topic. Sir, I've seen many doctors using one their poppy seed while preparing an import. Is that correct? See, by sixth edition of Organon, it is not, because it was written only one poppy seed, and I follow strictly a sixth edition, so it was written only one poppy seed. So I follow only one poppy seed. Only one global is followed. In my hospital, I follow only one. So coming up the next, I would like to know all the inputs of this case, case 6. I think everybody had their uh, I think in the group it was shared of this case, lumbar spondylosis. So male aged 41, case of lumbar lordosis. MRI clearly shows degenerative lumbar spondylosis with osteophytes. He has trouble of back pain since 3 months, more pain at left side, pain only on lumbar region, no history of fall of injury, but he has exert himself in prolonged bike riding. Now he has taken physiotherapy, pain is intermediate now. After that, he has come visit us. So pain in lumbar region for 3 months, location more at left side, onset sudden, decline gradual, aggravation at prolonged sitting, rising after sitting, bending forward, change position, rising after sleep, which continue up to daily activity. Amelioration by hot bath, amelioration by cold application or more. It was not clear though, but he said that it was amelioration by hot more. Past history, jaundice, gastric ulcer, back pain. Then the back pain was intermittent, like coming and going. Family history, father hypertension. Physical generals, habit, tea 2 time, used to have gutka, tobacco, desire sweet, thirsty. No, sorry, thirst is only 10 to 15 glasses. Uh, Bowel clear, but 1 or 2 times. Perspiration profuse, urine clear. I think everybody has the case details. Married, he lives in Syria. How's your nature? Not angry easily, but feels irritable due to prolonged bed rest. Before I had a habit of work daily. Now is staying home, which makes me slightly irritable. Is mixing nature, helping nature. I can avoid my own work to help others. Weeps easily. When hurt, when not to talk, who hurts me? When any incident, nothing, but anyone ignores me, it hurts. Hobby, watching movie, time spending. So memory is also good. So what do you think about your disease? When pain start prior, I felt nervous, but now I'm hopeful for recovery even after physiotherapy. But when pain gets intolerable, then tears in his eyes. So thermal towards hot. Now everyone has this case. I think since 2 to 3 days, everyone had it. Sorry. So let me know your inputs, what everyone chose or think to prescribe in this case. Phosphorus. Okay.
Pulsatilla.
Pulsatilla. Okay. Anacardium. Pulsatilla. Hypericum. Good. Phosphorus. Thuja. Any more? Dr. Dhruvi, Rustox, Pushpa Yadav, Rota. Very nice.
Pulsatilla.
Okay. I considered, sir. Pulsatilla. Any more suggestions? Ruta. So any more suggestions? Ruta, Rustox. Arnica. Okay. Please. So all done. Calcarea. So congratulations, those who reached Rustox. Repertory is just a tool. You need to confirm by the patient's symptoms. And what was marked here? Rising from sitting. And how can everyone can miss Rustox when the patient clearly said that he has pain? So Dr. Dhruvi, you're right. And I think there were only two people who suggested it, Dr. Preeti and Dr. Dhruvi. Congratulations. Your thought process was right. It was Rustux only. So it was very simple to select. Very simple. So it was, I'm showing this repertory chart just to show that repertory is just a tool and confirmation can be done only when you consider the complete symptoms in the case. You can see phosphorus coming up, sulfur, definitely sulfur comes up with every case. Calcarea coming up. The suggestions were right. But mental generals are like pulse. Definitely, Dr. Monica, mental general pulse, but I prescribe on this complaints, not on mentals. So I want to ask, these modalities are common modality? No, it doesn't. What is common here? Why it is taken important? Because the patient is complaining with the pain. If patient is saying that I'm not feeling better by this doing this, you should not consider. You should definitely consider when the patient is saying I'm not better on this, because pain can be on very, very different modalities. So for empowerment already, even in the acute prescription, we take those modalities that are pathomic, legal, and aggravation early morning case of ankle. See, ankylosing spondylitis is a different thing, because in every ankylosing, the pain is get aggravated, and so ankylosing there is a common, but yes, you can consider this aggravation, but you have to see the intensity of the aggravation. When the patient is totally cannot get up on it, then definitely you should consider this. Dr. Amir, let us see what Restux was palliative or curative. It was from Restux LM1 till Restux LM3. It was given like 0 by 1. From 0 by 1, then 0 by 3, it was stopped, and he's off medication since long. So you can hear his feedback by his own mouth, what he has experienced after the treatment. I have not given any remedy apart from Restux LM1, LM2, then LM3. Yes, Restus is ambithermal. So Dr. Ankita, if Rustus is ambithermal, it can be prescribed on both. Either the patient is towards hot or towards chilly. That is the way we call ambithermal. That's why it is known as ambithermal. Dr. Ajay, no, it's not important here. What is important here is the priority should be given on his complaints, what he's telling to you, what he's suffering. Mental and general symptoms only consider when you don't get anything. At that point only you have to consider.
नाम क्या हुआ आपका?
अजय अग्रवाल।
आपको क्या क्या प्रॉब्लम थी?
Correct.
कमर में दर्द था, चल फिर नहीं पाता था, ना बैठ पाता था।
अभी कैसा है?
अभी एकदम ठीक।
कितना महीना हो गया?
साल भर हो गया।
साल भर से आप दवा नहीं ले रहे हैं?
नहीं, साल भर में लगभग 11 महीना हो गया दवा ले रहा हूँ मैं।
अभी आप
1 महीने से बंद है।
1-1.5 महीने से बंद है। आप सही हैं?
एकदम सही है, कहीं कोई तकलीफ नहीं है।
ठीक है।
So what you want here? Dr. Amar, I hope I have answered my question. Your question. But let me teach you here. He may get back pain if he doesn't get his lifestyle corrected. Again. So here the point is telling the patient to improvise his health, diet and nutrition along with the medicine. That is very much important. No. Nothing is being given. Only Restox. That's it. So in chronic cases, Dr. Hanuman has clearly stated that without deep management, the patient cannot be cured. His suffering may return. In this case, Restox shouldn't be deep acting. No. See, after Restox, if in a month or 6 months or whenever he comes back, and if he has any more symptoms or any different picture, at that time I would think to change the prescription. But if he complains on the same way and he has the same modalities what he was having earlier, I would increase the potency and I will give the same medicine. Because when the patient was better on that medicine, you cannot change the medicine when the patient was better on this medicine. If he's complaining the same complaints that is relapsing, then change the scale, change the potency, don't change your medicine. That's why we are second prescription always fail here. We have a zeal to always change the prescription in the quick form, but you don't have the confidence that this prescription was working, so it will work again and again only. But change the potency of it, change the scale and see how it's giving the result. After that also, if it doesn't give, then you think of changing the remedy. So unless your remedy is fully tested on all scales or any potencies, don't change your prescription unless you're not confident enough. No, Dr. Meha, it is important, the mental symptoms, because case taking you cannot compromise at all. But the necessaries, you're not getting the picture here. The picture was here, the pain, he was suffering from lumbar pain and he was giving the whole focus on lumbar pain. So the mental symptoms, the only comes when we don't get anything on LSMC or we don't, the patient will precise with have a background history of any major suffering in their life. What is mental symptoms? What do you understand this? Only complaining of pain, that is mental symptoms. Do you consider that? Mental symptoms are their own sufferings. How they went. Like last session I already explained, जब भी मेरा परिवार वाला कुछ बोलता है मैं बोलता नहीं हूँ क्योंकि मेरे को गुस्सा आ जाता है और फिर मेरा पेन बढ़ जाता है. That is mental symptom. It is related. His suffering is related to his pain. His emotional trauma plus pain. Connect the dots here. Then you will consider mental symptom. When the patient is entirely focused that I have this pain and there is no any significance of the mental symptoms here. How do you prescribe on mental symptoms then? Did he had any history of trauma? Did he had any mental consequences in his life which affected after that he got lumbar pain? Then I would have considered anything. So this is very important here. Case has to be taken well. A well case taken is half cured. That is true. And it will be always. You have to know in and out. But you cannot dug up the case every time. Majority of the times, I'll tell you the true fact. When the patient comes in the first visit, he reveals only half of the case. And when he comes for the second visit, he reveals more. In every first visit, you cannot judge the patient or you cannot have all symptoms at your desk. दैट इज नेक्स्ट टू इम्पॉसिबल. ऐसा कोई करेगा ही नहीं कि एक विजिट में सब कुछ क्लियर हो गया. So it depends patient to patient. Maximum time patient comes and when you prescribe, after that again he goes back, again he open the door, sir ठीक तो हो जाऊंगा ना sir, then he comes back again, ठीक तो हो जाऊंगा. That is observation. He has strong anxiety of health. Then you think of nitric acid, think of kali carb, think of calcarea carb. What he might be suffering from a cancer also, or he might be suffering from any deep pathology. That anxiety is seen in front of your eyes. You have to observe through your eyes that what is he trying to do in your clinic. He's not leaving the seat. You are calling the next patient, he's still sitting and still has a lot of queries and still asking again and again. Then going back again, he's saying, telling the, I'm not understood how to take the doses. Please understand me. I don't want to make any mistakes. I may eat wrong way, so it doesn't work. So I may not get cure or may not get better. This intensity of anxiety will be seen in his words of expression, his way of speaking, way of talking. From that you have to extract it. ये नहीं बोले मेरे को तो बहुत चिंता है सर, मेरा बीमारी कैसे ठीक होगा. ऐसे कोई पेशेंट कभी नहीं बोलता. नेवर. So can you repeat when we change or increase the potency? When you're confident of the prescription and that he was doing better in particular, suppose you have choose like in LM only. If he's better on LM1, it is continued. If it's like pain on and off, then you increase the scale. Then again he says I'm better, then again pain comes 1 or 2 times or 3 times, then again you change the scale. You keep on increasing the scale until unless he's better. The same goes with LM as well as centesimal also you can see. But centesimal, you cannot have the frequent repetition of course 1M, 10M, CM, 30, 200 as well. But that is the only reason why LM has been used, because you can repeat it more and further times compared to centesimal. And this is the only reason I choose LM more preference than CM. And LM does give brilliant results. It is not my verbal statement. You yourself use it and then you share your experience. Sir, the patient comes again with the same complaint, so we'll again start. No, not with 0/1. No, if the remedy is same, then not 0/1. If the remedy is different, then we have to start with a fresh LM if you're giving with the next remedy. If your remedy is right, no matter what potency you give patient, definitely it is right. Heard from our teachers, what's your view? No, definitely if your remedy is right, it will work any potency. But what happens when it exhausts? Suppose if you give Colosin 30 and it gets exhaust, and after that patient again comes to your desk and asks for that, I'm not feeling better. Now what you do? This is the only reason Hahnemann has given a greatest gift, that is LM potency. Because in all these years, what I have been experienced being managing these cases of emergency, you have seen like pulsatilla also in the last case. What my experience have been the experience in this LM potency, that majority of the times 30 or 200 get exhausted. After that, I have nothing to do. But as soon as I jumped to LM, I got better result than centesimal. This is the only reason LM potency is more superior. For DD, we need mental support. In this case, I did not get. For DD, I didn't understand, Dr. Kavita, your question. For DD, we need mental support. In this case, I did not get.
Like phosphorus also came, calcarea came.
Acha, no. That's what I'm telling. Don't be focused on the repertory sheet. You focused on his chief complaints. He said rising from sitting was worse. Hot application ML, prescription Rustox. It's very simple.
Okay.
If we keep on considering when to stop repeat LM, when the patient is better, Dr. Hardik, you stop the LM, give him SL or anything else. So to conclude my session, it's already 10:40. If the same symptoms appear after 1 year and the patients come from 0 by 1 will start or what? No, will start from 0 by 2, Dr. Monica.
તમે બધા કેમ જીન્સ પહેરી હકતા હશો?
Next case, palmoplantar psoriasis. Everybody had this case? No, I doesn't feel any aggravation in LM. Either it works or it doesn't work. Psoriasis since 3 years. She was consulting to a doctor. Uh, so now psoriasis on location: palm, sole, lower back of head, itching, aggravation early morning. Hands keep when she washes from the warm Dettol water, she feels better. Skin dry. Winter aggravation. Dry skin when she moisturize or coconut oil, feels better. Mind, as this is on palm, her all work is stopped because her business affects because she is a tailor, which is the main source of earning for her family. Past history: chickenpox, appendix surgery, abdominal surgery. Family history: brother diabetes, piles, mother also piles. Habit: tea, coffee rarely, thirstless, tongue dry, imprint of teeth, perspiration scanty. Dreams: sometimes frightful, dreams of unknown people, desire salty. Occupation: tailor, 10th pass. Marriage after 3 kids. So here everybody was talking about mental symptoms. Here you listen the story. After marriage, childhood was good. Fear of dark, alone, deep water because she 2 times she was drowned. If someone scold her, she wants to stay alone always. Interest on study, but due to family problem, she could not study. She wanted to do something and her name or fame go. She is ambitious. So relation with the husband not good since marriage. After marriage, she know that he was a drunkard. Then one daughter born. After 1 year of marriage, he started abusing her, fight her. Then 2 kids were born. After this, torture got increased. Parents support her, and after third child born, she went back to her mother house. So now since 10 years, she lives separate from her husband. Now one son stay with her and 2 kids stay with her elder sister. Now no contact with husband. Husband sold all the things in home and now he live like a beggar. So even after this torture, I feel that if he wants, then uh, he can he can grow in his life, or his life is waste. I regret that due to me, he's like this now. Torture mentally and physically more. Now feel that my life is lost due to this marriage. Depressed feeling due to not having family. When seeing other couples, sometimes feel sad. After that when thinking about family, kids, then anger comes as he did waste my life. Sometimes speak to God, scold him that if you gave, then give better. If not, then don't give anything. If you give 3 kids, then give income of that type. Weeping disposition, weeping now while telling her complaint. When she was telling, she was weeping as well. Stress about children, about disease, about health. Uh, Due to this, she is not doing her work because of the psoriasis. Due to financial condition, she can't also opt for the treatment. So anger when somebody cheats on her, someone promise her something and not fulfill. Shouting when I get more anger, I feel like I should harm myself. Once I tried to cut my hand. Time passes hurriedly. That feel if some extra time, then work. She tries to finish her work. Fear, anxiety about disease progress because I'm alone and there is no one for me. Dream, someone choking my throat. I'm trying to shout but cannot shout. Thermal is chilly. This is her hand and feet. So I think everyone had the complete case. What is the remedy coming up?
Natramure.
Natramure. Very nice, sir. Very nice. Cyclamen, Merxol, Ignitia. Okay. Natramure, sepia, petroleum, petroleum, natramure, natramure. Natrum phos.
Very nice remedy કીધી ડોક્ટર પેલા જ કીધું.
Natram As. Natram Mure. I'm very happy that people are coming with the remedies and Dr. Lakshmi CPR, because I'm not showing something different. It's all written in the book and it's all very simple cases. This is the reason, and what we do here is very simple. कोई अनोखा नहीं होता यहाँ पे. Whatever is happening here, it's in front of everyone. Petroleum, CPR, okay, graphitis, natramure, gunpowder. Okay, sir. Natramure. So everyone can see the prescription. Sorry, the repertory chart. Still, any more suggestions? Definitely, it's CPR only. And I'm very happy that everyone came to natramure, but there was a subtle difference here that natramure is very, very hot and CPI is chilly. And natramure will have warmth aggravation, not amelioration. It was a very written in the chief complaints of this case. So let me show you what happened after CPR. This is the change before and after CPR. From LM1 till LM4, she's still on the treatment. See LM4, this is her legs and hand. $10.50. Okay. Sir, why natrum phos? She doesn't had a natrum phos like picture, Vandana. And why natrum phos? You tell me. Is natrum phos is ambitious? If natrum phos is uh, very, like warmth amelioration in natrum phos, or there is lot of itching, or there is lot of you can say lot of indifference. If there is indifference in natrum phos, is there? Diagnostic rubrics in reportization. Yeah, very nice question. I would have definitely taken skin psoriasis or palm psoriasis, but the only reason I don't take it because that made me like, it makes us handicapped because of the limited remedies in this section. All I wanted as a whole that what the picture of the patient here is. So I never take all the I am more focused with the Boger concept LSMC to be precise. For me, that's matter most. And what is true to the part is true to the whole. So to conclude here, homeopathy is very helpful in cases of many neurological conditions like psychical or psychological. It always helps us to know underlying symptoms for such as may not like long term may not seem important, such as long term grief, shocks, emotional attacks. I'll share a case. Like yesterday only, my hospital closed, and I got a call from nearby. There was an emergency case. The around 35-year-old girl, she fainted. She's a HR on a company, And my friend called me up and that please can you come and see her. I took my assistant Dr. Rashmi along with me and we went there, and I saw the pulse. It was full bounding pulse. It was full bounding pulse. Pulse was 121. She was at distress, not feeling at all, not opening his eyes at all. She said chakkar aa raha hai, vertigo, lot of vertigo. She cannot even raise her head. Chakkar aa raha, and we checked the BP. It was 140/100. This is the case. Now tell me the remedy. I asked her if anything happened her in the office, if somebody shouted at her. Nothing. Nothing was uh, coming up. This is the case. This is like the patient is fainted and she has sense, but she's telling that chakkar aa raha hai, cannot raise up my head. Chakkar aa raha hai, and the pulse is high. क्या लग रहा है? चक्कर आ रहा. That's it. This is the input. Belladonna. Very nice, Dr. Bandana. Brynia. Ignitia. Arnica. Gels. Absolutely, Dr. Jagruti. I took gels along with me. Dr. Monica. Econite. Calcarea Carb. Belladonna. But I didn't give gels. Naxomica. Okay. Running short of time, so I'm revealing it. The remedy was Econite because first it was sudden. Now the suddenness of Econite should have been considered here well. अचानक बेहोश हो गई. Pulse was full, and as soon as we gave Econite, her pulse came down to 80, 85, then 70, 75, and she was completely well, I think by 4 or 5 doses of Econite. Now tell me, what should I have asked? She's a HR, she's a desk job. I asked her ये क्या करती है. He told me that ये HR है. HR का काम क्या है? 200. HR का काम क्या है? बैठ के सब कुछ देखना, manage and everything in the company. So I asked her the second question when I found the BP is 140/100. 140/100 में किसी को चक्कर नहीं आएगा, कोई फेंट नहीं होगा. So I asked, how many pillows do you use while sleeping? She said 2. Once she got better, I asked this question. I said, you have a cervical spondylosis. After that, she said, I have also tingling in my hands, sir. That was more confirmation part. So she got vertigo due to her posture, and she's suffering from cervical spondylosis. This is the case. Now tell me whether I should be more disease specific or rather the patient's symptom specific. What's your answer? पेशेंट तो बताया ही ना मेरे को कि वो सर्वाइकल स्पॉन्डिलोसिस से बेहोश हुआ था. वो तो डॉक्टर का काम है पता करना. Exactly, my dear friends. Here's the point is, patient cancer लेके आया या खांसी, you have to see how it ameliorates, how it aggravates. Tell me honestly, knowledge of medicine is very, very important. Very, very important. But where it is applicable, there you have to apply it. But when the patient is in front of you with the symptoms, you have to treat according his symptoms. If you be disease specific, अरे इसको तो ये हो रहा है, and you start thinking about giving any random remedies, they won't work, and at last you will fail, and you will say homeopathy तो काम नहीं करता सर, उसको तो saline लगा देना था. And that behind that office there is a allopathic hospital. They could have taken her, but they could not because the patient was not able to walk, or they were not able to carry her to the next hospital. This is the only reason they called us. So I had a great advantage to show what homeopathy can do, and I was proud of myself that I did it. Now how I was able to do is just I explained the procedure. It is very simple. On see on what you treat. Neither be prejudiced of इसका तो ये हो गया होगा, इसका वो हो गया होगा. Always connect the dots with the symptoms, then you'll get the right. How did I diagnose it? जब कोई possibility ही नहीं है उसके चक्कर आने का, I stayed focused on a cervical region. And I asked, and she told, मैं बड़ा सा तकिया 2 लेती हूँ sir. When she got better, she told me that लेना बंद करो भैया, plain सो, ये तो आते ही रहेगा attacks if you don't correct your posture. So to conclude here, without wasting time, the similimum, as Dr. Boger said, the similimum curative remedy in bracket releases reactive power strong enough to re-establish harmony, which in turn is capable of sweeping away almost any morbid disease condition. So any queries or anything? Here's my email ID, my hospital address, my Instagram. So I would really thank Dr. Kamlesh sir. He gave me an opportunity to speak about my cases, my experience, and I'm very thankful for whole team of Saturday workshop. And it is a beautiful gesture. I think everyone has the zeal to learn, zeal to improve their practice, help everyone. That is the only motto we are sitting here and we are watching this. The only reason we are seeing here that we have that inner conscience that if the patient comes to us, we have to make them well. This is the only reason everyone is here now. And with that great motto, we can really help everyone. But that comes from inside, not on the superficial. अरे अभी भीड़ है, अभी इसको patient नहीं है. भीड़ तो रहेगा ही always रहेगा. But that one patient in front of you, if you treat him, if he gets better, that inner peace is what your main achievement after treating someone. So thank you sir. Hereby rest.
Thank you Jitesh sir. Thank you very much. और अब मैं
Thank you Dr. Pankaj. Thank you.
थैंक यू वेरी मच कि आपने हमारी रिक्वेस्ट एक्सेप्ट करके अपना जो एक्सपीरियंस है वो शेयर किया सब लोगों के साथ, और डेफिनेटली सब लोग कुछ ना कुछ तो इसमें से सीख के जाएंगे. I would like to request Dr. Kamlesh Mehta sir to please share his experience from today's session. Please sir. Over to you Kamlesh.
Dr. Jitesh, thank you very much, but the thanks is very little small words for it, because now you are part of the family. So when you are part of the family, a lot of expectations are going to come and people will always approach. And we hope that you continue your relations and being with us even later on. Whatever you shared, if I have to put in very little words, then it is Haath Kangan ko Arsi kya? Because results itself speak, they are in front of us and it doesn't require any further explanation. Even then, you have very rightly said right from the beginning that homeopathy is simple. If it is so simple, then we have to remain simple and prescribe simply. So to open up all the notes of our complex minds and see things as it is, whatever it is. Rather, usually what do we do? That we continue to see or try to see something beyond. That's and looking for something extraordinary, something special, something different than whatever is right in front of us. Because truth is also very simple and it is always right in front of us, provided we accept it. So here the first point is the acceptance. Whatever I see, whether I accept it or not. And second very important point is having sound senses of the physician. If he has sound senses, then only it is possible to observe the things the way it is. So these are something very important points that you have brought out. And before that, what is very important that you have put across is what is our purpose of treating this case. Whether my purpose is palliation, my purpose is curative, my purpose is just symptomatic, my purpose is bring dispositional changes. So your purpose has to be very clear. Though we all are abide by the purpose that is stated in aphorism number 1, that high and only mission is to cure the patient. But thereby, when it comes to the practice and application, we always put certain things aside and put our own me factor into it, and then the problem begins. You have constantly put one point in front of all of us, that is what is to be treated in every individual case. So whatever is to be treated, that you have put forward and ahead, and just follow the path to see that that is treated. And that may be guided by the causation, that may be guided by modality, that may be guided by behavior. Whatever is prominent, clear, defined, and something that point to the remedy. As we should not forget ever that aphorism number 7 says, the disease will take you to the remedy. And we should be ready to have that journey. And Dr. Jitesh has rightly said that what is very important is morbid phenomenon, the journey of the disease. And if we focus on the journey of the disease, then how the deviation is taking place, what the deviation is taking place, and during the deviation, what is happening, if we just focus on that, then obviously that will give us the guidance that how we should decide our remedy. And in that word, suddenness, in the morbid phenomena, how did things happen? The sudden, and that suddenness is causing, taking to aconite. The cause is taking to arnica. Observation is taking to colocin. So all these things are in nothing that we don't know that Dr. Jitesh has said. We know it, but the only thing is we don't integrate them or apply right thing in the right time. And we should not forget, Jitesh said, thank you very much for your saying that rare remedies are rare to occur in the cases. What occurs is usually that we know, and our syllabus is made in the manner that what usually we are bound to get in the practice. So we should focus on what is common, and we always find out about something uncommon, because we want to make every case unique and every case for the seminar. But what is important is that every case has to be cured. And thank you very much, Dr. Jitesh, for all these simple facts bringing in front of us. And we hope that we see you again and again and very soon. And already you have built up the demands, and people want fewer cases from you. So I'm sure you start preparing them and integrating such collections. And very soon, in a couple of months, again, we will like to have you here to share your experiences.
Thank you so much, sir. Thank you, sir. Thank you, sir.
And whatever simple must have shattered a lot of complexities in our mind. And so there must be various questions coming up in the. So don't hesitate to write, sharing your questions in the group, or you can write directly to Dr. Jitesh, and Dr. Jitesh will be always available to answer the same. With this, we conclude our session over here. If there are any suggestions or questions that people want to put across, please put on the chat box or in our group. Thank you very much, Homeopathy Forever Charity, Dr. Pankaj Lakhani and Dr. Jayesh Ghadia for providing us such a platform and providing event management. And on behalf of Phenomenon Gurukul, whatever best can be provided for the learning to provide the academic platform, that is we are providing, doing it at our level best, and the students who are continuing their support for such activity, they are making all the arrangements. So thank you very much, and see you soon after fortnight.
See you, sir. See you, Jitesh.